All right, everybody, welcome back for another deep dive. Today, we're going to be taking a look at a really serious issue,
Yeah.
the drug crisis, specifically in North Carolina.
Okay.
We've got some excerpts from some reports here,
Yeah.
and we're going to be focusing mostly on like fentanyl and meth.
Right.
Just to give you an idea of how serious this is. One of these reports said that in 2021, 77%
Wow.
of overdose deaths in North Carolina involved fentanyl.
That's a huge number.
77%. That's a crazy amount.
It is. And you know, the thing about fentanyl is it's so potent, it's 50 times stronger than heroin.
Oh, wow.
So even just a little bit can be fatal.
So it's like, even if you think you're taking something else,
Right.
it could be laced with fentanyl and you wouldn't even know.
Exactly. And that's what makes it so dangerous.
And you know what's interesting? The reports highlighted Raleigh and Fayetteville
Okay.
as being hit particularly hard. Why is that, I wonder?
Well, Fayetteville, especially, it's right next to Fort Bragg,
Oh, that's right.
which is a huge military base. And that means you have a lot of people coming and going. A lot of them are under a lot of stress.
Sure.
The financial pressures and just the mental and emotional toll of military life. It can make people more vulnerable to substance use.
Yeah, that makes sense. And then on top of that, the reports also talk about how the mental health crisis we've been seeing,
Right.
especially after COVID, has just made things worse.
Absolutely. I mean, the pandemic was so isolating for so many people, and there was so much stress and anxiety. And on top of that, access to mental health care was really limited for a lot of folks. So some people turned to substances to cope, and you see this even more in communities that already have barriers to health care. It's like one problem just leads to another.
It's a vicious cycle.
I just,
But you know, it's not all doom and gloom. The reports also talk about how North Carolina is fighting back.
oh yeah, they're definitely taking this
Oh,
seriously.
what are they doing?
Well, they've distributed over 700,000 units of naloxone,
Wow,
which is a medication that can reverse an opioid overdose.
that's amazing.
It's saving lives, for sure. And they're also making fentanyl test strips more available,
Oh, that's
where
smart.
people can test their drugs before they use them and make sure there's no fentanyl in there. It's all about harm reduction.
It's about meeting people where they are.
Exactly.
But what about the bigger picture, though?
Yeah.
What about the lack of mental health and addiction treatment?
Well, they're working on that too.
Okay, good.
They've been expanding mobile crisis response teams.
I've heard about those.
So instead of waiting for people to reach out for help, these teams go into communities and offer support to people who are in crisis.
That's a great idea.
And they've also been expanding Medicaid coverage for substance use treatment.
That's huge.
It is. It removes a major barrier for people who need help.
So it sounds like they're really trying to address this problem.
Yeah, but it's a huge challenge, and fentanyl-related deaths are still going up.
So it's an uphill battle.
It is. It's going to take a lot of effort and a lot of different approaches to really turn things around.
Well, it sounds like they're doing what they can. So let's recap here. We've talked about how bad the fentanyl problem is, especially in places like Raleigh and Fayetteville, and how mental health issues and lack of resources
Right.
are contributing to the crisis. And we've seen how North Carolina is trying to fight back. But there's still a long way to go.
For sure.
So I want to leave you with this thought. If you were in charge, what would you do to try to solve this problem? It's a complex issue, but it's something we all need to be thinking about. Thanks for joining us for another deep dive. We'll see you next time.